does hereditary testing or genetic counseling come in as a screening tool?
Yeah, hereditary testing, I think, is so important. I think, and it's I would say it's necessarily the best screening tool. It's often best, once someone has already been diagnosed and that the disease is in the family. But I do think, it's really, really important for people who have a family history of any cancer, and I think, again, I kind of go back to the fact that I think a lot of us don't really know our family histories. I find for a lot of people when they're first diagnosed with a cancer, that's the first time that they go talk to mom and dad and to Uncle Joe and Aunt Shirley, and they say, "Hey, do we have anything like this in the family?" And they're like, "Oh, actually, turns out," I often hear in the second and third visits, "Oh, actually, turns out I do have a strong family history of
Uh,
cancer." So, I just urge people, it's not an easy thing to talk about, but, I urge people, have that conversation with your family, and also be open to sharing that information if it was you, because, these things have, heavy implications on everyone in your entire family. And also importantly, too, it doesn't have to be the same cancer, too. A lot of people think it's
mm.
only if you have a family history of colorectal cancer that you might be at increased risk of others. But there are many syndromes that link, uterine with colorectal and stomach and breast and whatnot. And so, being aware of any family history of cancer can really help us trigger the right, genetic testing to find out, do you have a hereditary syndrome or not?